Welcome to the deep dive. Today we're plunging into, well, a really common issue, especially for active young people, knee injuries.
It's something we see all the time.
Yeah, and if you've ever had that sudden pain or, seen someone go down with swelling or that really weird, unstable feeling after a twist,
Mm-hmm.
you know how confusing it can be? The symptoms, they just seem to overlap so much, don't they?
They absolutely do. Figuring out what's actually going on can feel like real detective work sometimes.
Exactly. So our mission today really is to try and cut through some of that confusion for you. We want to unpack these traumatic knee injuries in younger folks.
Give you a clearer picture.
Yeah, a kind of shortcut to understanding the main types, how doctors figure them out, and maybe most importantly, why getting it right and getting it right early is just so crucial.
And that really is the key takeaway, the so what.
Yeah.
Because a wrong diagnosis or even just waiting too long to start treatment,
Yeah.
that's not just about short-term pain. It can genuinely lead to, well, significant long-term problems. We're talking chronic disability affecting daily life or even, getting osteoarthritis much, much earlier than you should.
Oh.
So the information we're going through today, it really can make a huge difference down the line for a lot of young people.
That really hits home.
Yeah.
It makes you wonder, though, why the knee? Why is it so, I guess, vulnerable? Especially in active kids and young adults who are always moving.
Well, the knee joint is incredibly complex. It's a marvel, really, designed for huge loads, lots of
And
movement,
exposed.
very exposed. You've got these powerful ligaments, the cushioning menisci, the bones meeting just so.
Hmm.
It means it's pretty susceptible to trauma.
Okay.
And the big challenge, like you said, is that even though you can injure different things inside, the outward signs, the pain, the swelling, that instability, maybe not being able to use it properly, they often look frustratingly similar.
Right.
And that's exactly why you need that detailed clinical reasoning, that detective work we mentioned.
So, okay, before we dive into specific cases, let's quickly map out the scene. What are the key parts inside the knee that usually get injured? The usual suspects.
Good way to put it. So centrally, you've got your main stabilizing ligaments. There's the ACL, the anterior cruciate ligament.
Stops the shin bone sliding forward.
Exactly. And the PCL, the posterior cruciate ligament, does the opposite at the back. Then on the sides, you have the MCL medial collateral ligament on the inside, and the LCL lateral collateral ligament on the outside. They control that side-to-side stability.
Okay, ligaments covered. What else?
Then you have the menisci. Those are the C-shaped bits of cartilage, one medial, one lateral. Think of them like shock absorbers or washers in the joint.
Crucial for cushioning.
Absolutely. And then there's the articular cartilage itself, that smooth, glassy surface on the ends of the bones. That can get damaged too.
And the bones themselves?
Yep. The bones can fracture, particularly the